Hello, good morning. My name is Dr Priya Verma. I'm one of the key opinion leaders for Endolift treatment in the UK, and today I'm joined by Mr Daniel Ezra, who is the research lead and head of oculoplastic surgery at Moorfields Eye Hospital. And I'm joined here in his Harley Street clinic today to discuss the Endolift treatment. So Mr Ezra, you've been doing Endolift procedures for a short while now. I would like to hear from you really how you feel Endolift fits into your practice.
I have a very large surgical blepharoplasty practice, treating many thousands of patients every year. But there's a real unmet clinical need for dealing with a particular clinical entity, which is malar edema. And that describes the propensity of fluid to accumulate around the apex of the cheek. And it's due to the lymphatic drainage of the face, which tends to be more deficient in that area, coupled with various anatomical features around the lid and the ligamentous support of the lid-cheek interface. Patients tend to get quite significant edema in that area, and it often tends to be very resistant to surgery. To the degree that often I will turn down patients because they have these areas of edema, because of course any surgery can precipitate the swelling and make the problem even worse. I was very excited when I came across this particular technology because it was biologically plausible at having an effect to improve those areas. The idea of actually being able to reduce fat pads and dead space in those areas was absolutely essential. Along with tightening the skin, means that this could potentially be a technique to augment surgical blepharoplasty, or even be used as a standalone treatment to treat this one area for which we just simply don't have any effective therapies at the moment.
So Mr Ezra, what periorbital indications would you treat using the Endolift laser?
For me, it'd be very much about targeting malar edema specifically. I know there are some applications of using it to reduce the fat pads underneath the eyes themselves. My feeling is that there's probably a greater safety profile of using the treatment in the cheek area rather than the eyelid area, which has a slightly closer proximity to the eye itself. But it's really about that fluid retention in the apex of the cheek that I really am most interested in focusing on. And of the group of patients we have attempted the treatment on so far, we've had some fantastic results. We've had patients with extremely dense edema, which has been completely resistant to other forms of treatment, getting very significant results. Others have not really had the kind of effects we'd hoped for. But we have certainly seen some very positive outcomes, which is why we're persevering with collecting more data and offering the treatment to more patients. I think my view is that the treatment clearly has applications in the periocular area. I think it's really our job to try and explore the factors which could predict positive outcomes.
So earlier, Mr Ezra, we were discussing how in the aesthetics field, there's a lot of patients who actually present with malar edema, and when they go and seek advice from an aesthetic doctor, they are offered treatment with dermal fillers. And you've said that, many patients have come to see you, being an oculoplastic surgeon, to correct this problem because it's actually further worsened the issue. How do you think the Endolift treatment factors into kind of improving the outcomes for patients like this?
Yeah, it's a very common clinical problem that I see. I will probably see a couple of patients a week with severe malar edema, which is exacerbated by the use of fillers. I think one of the fundamental problems is that there's a very poor understanding of malar edema, and often these patients will attend aesthetic doctors or clinics and they'll be treated with filler injections, which is of course completely inappropriate. Fillers themselves exacerbate edema because of their hydrophilic properties. The patients often won't realise this, and they come in, a careful history and examination is taken, often with MRI imaging to determine the nature and distribution of the fillers. That's all then dissolved, which typically improves the edema dramatically, but then we're left with the original problem, and I think often those patients are ones that Endolift could work very well for. But I think education, training, aesthetic clinics to understand that malar edema is not something that can be treated with fillers and really needs to be referred on for more specialist care.
So, Mr Ezra, you have experience with treating the periocular area with Endolift. I wonder, could you tell us what your patients' experiences have been? What sort of downtime are they experiencing, and how safe do you feel this procedure is for that area?
Well, although the outcomes have been variable, what's been very pleasing to see is that the downtime has been very short, that they've not had any significant side effects. Patients will typically experience very minimal pain during the procedure and relatively transient swelling, typically no more than a week, and perhaps with a little erythema in the areas as well. We've not seen any ocular complications arising from this, again, provided that the appropriate energy settings are used on the device and that the appropriate ocular protection measures are taken. I've not seen any problems at all. So in that sense, although it seems not everyone is benefiting from Endolift at the moment, I am happy that with the numbers of patients we've treated so far, we've not seen any significant complications at all.
So, Mr Ezra, who do you feel should be treating the periocular area with the Endolift treatment?
Well, I think the way that all of cosmetic treatments and surgery is going at the moment is that there's a recognition that it is an extremely subspecialised set of conditions. In my view, all treatments around the eyes, particularly where eye protection is involved and an eye examination may be involved, should really be conducted by eye specialists. I personally would only really be treating that area myself. I do feel that this is something that should be in the sphere of oculoplastic surgeons, or if more general aestheticians or surgeons are going to be treating the area, they really should have the support of an eye specialist. I think having a background in ophthalmology is very important because, of course, the eye needs to be examined before these treatments, and that helps to anticipate problems, to assess a baseline, and if there are potentially complications, you need to be able to examine the eye and understand what could be going on. And I think for clinicians treating the area who may come across a problem, it becomes extremely difficult when you have a complication in an area that you have no understanding of and don't really even have the vocabulary to understand what could potentially be wrong.
Today we've got a really exciting day planned. We're going to be doing a series of periocular Endolift cases, and we'll be refining further our protocol to better understand which patients have the best treatment indications, which settings we should be using, and this will just further help us with our case series on better understanding how Endolift can be applied to give the best outcomes for patients with problems such as malar edema, malar bags, festoons. So, Mr Ezra, how will you be approaching today's case series day?
Well, we're going to be building up our numbers to get a reasonable amount of data. We are doing we're performing very careful objective and subjective assessments of the malar edema, including quantitative volumetric 3D imaging, so that we can better understand what the long-term effects of this are and be able to really understand the efficacy of the treatment. And to do that, of course, we need patient numbers. So we've got a variety of patients who have, with a variety of clinical characteristics, all with malar edema, who we're going to be treating, and hopefully we'll get some positive results for them, and hopefully this will help us to understand better what the good positive predictors are for safe and effective treatments with this new technology.